Now, the reason we're concerned is it's like a variant. It's called Clade 1b. Sorry for the name. It's a variant of what we had seen for many decades that had been endemic in Democratic Republic of Congo and West Africa, East Africa. But this one is spreading very rapidly, and it's spread to countries in Africa that have never seen it before, such as Rwanda, Kenya, Burundi. We're seeing a lot of cases in Burundi and also in Uganda. And these are countries that have got a lot of contact with the rest of the world. But so that's a threat to the rest of the world, but it's really because it's spreading so rapidly, causing so many more cases than we've seen. We've seen in this half year more cases than we saw all of last year, and last year we saw more cases than we were seeing before. And that's one of the things that we looked at even before we declared this public health emergency of international concern. We called for manufacturers to submit their vaccines for what we call an emergency use listing. This will enable the partners, particularly UNICEF and Gavi, to procure those vaccines and get them quickly to the affected communities. Now, obviously, a vaccine works by protecting you from getting the infection, so it doesn't help the people that have already got it, but it will slow down not just transmission. I mean, the main purpose of a vaccine is to protect you from the illness, but again, it will protect those most at risk, especially, as you mentioned, the children, from severe illness and death. And as you mentioned, this has got a high death rate. So it's critical that we get those vaccines to help prevent that. As yet not, but also the other reason we renamed it was it was just a completely incorrect name. It was called monkeypox before because it had been found in monkeys in a zoo in Denmark back in the 50s. It wasn't seen in humans till the 70s. And the animals that transmit it, it's very rarely transmitted by monkeys. It's usually small rodents. So it was altogether just incorrect. But you're right, also giving anything a name of an animal does start stigma. We're not seeing that at the moment. Our main concern is the level of spread and the communities it's in. It's in refugees, in camps, in the really terribly conflict, war-torn areas of Democratic Republic of Congo. So these are people who've already are physically under great stress. They're starving, they're mentally distressed, and we've also seen quite a lot of people with HIV. So again, it's really, really important to mobilize the resources, and we need to really mobilize the financial resources as well and get to work to stop it.
The World Health Organization has declared MPox outbreaks in Congo and other African countries a global health emergency. Here's what we know. MPox, also known as monkeypox, is an infectious disease that's spread through close contact. It's from the same family as smallpox, but the symptoms are a little bit less, such as body aches, fevers, as well as chills. More than 500 people have died from the virus and thousands of people have been infected. This is more than a 160% increase of cases from the same time last year and nearly a 20% increase in the number of deaths. There's more than a dozen countries affected, but Congo has the majority of the cases. It's impacted adults as well as children, and there are a growing number of children than ever before that are being hit by the virus, say health officials. There's also a new strain of the virus that is emerging and has people very concerned. There is a way to stem MPox, but it requires the use of vaccines, and health officials say there are not enough vaccines on the African continent. The declaration by the World Health Organization, the hope is that it pushes donors and countries into action to send more money, resources, as well as vaccines to countries in Africa.
Last week, I announced that I was convening an emergency committee under the international health regulations to evaluate the upsurge of MPox in the Democratic Republic of the Congo and other countries in Africa. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of MPox in eastern DRC, its detection in neighboring countries that had not previously reported MPox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of MPox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law. The emergency committee's advice to me and that of the African CDC Centers for Disease Control and Prevention, which yesterday declared a public health emergency of regional security, are aligned. WHO is on the ground, working with the affected countries and others at risk through our country and regional offices, as well as with partners including the Africa CDC, NGOs, civil society, and more.
Burundi, Kenya, Rwanda, and Uganda are among the countries that have reported MPox cases for the first time. According to Africa CDC data, there have been over 17,500 cases of infections of MPox and more than 500 deaths.
Pause.
Telcom free, weka credit kwenye line upate free bundles. Replacement tunafanya.